Kincaid grade level scale. So you're looking at the basic reading is 2-4, average is 8 to about 11, skilled is up to 18. So if you look at what that entails, basic is when you're learning to read as a child, and the books that you read, the Gruffalo, Harry Potter is more like an average reading, Jurassic Park, A Brief History of Time by Stephen Hawking, that's more like 14 to 15, and then the high-end academic paper is 18. So when we're writing abstract, you have to sort of like pitch your abstract to the level of the skill of the people you're presenting to. Sometimes the people you're presenting to are professors of optometry, ophthalmology. Then go ahead and impress and use 18. But sometimes you're presenting to medical students. Even here, with my experience of presenting to medical doctors, you think, okay, he's a doctor, he knows this. But they remember what they did in medicine, and they've specialized in dermatology, for example. And then you're talking about something in ophthalmology. They have no idea. For that level, for that kind of physician, I will actually write my abstract at a level 10. That's because that's the only thing they would understand. Whereas if I was talking to practicing optometrists, optometry professors, ophthalmology professors, then I would do a 16 or 18 because they have a clear idea what I'm talking about. So, as I've just said, it's important to consider your audience. Who are they? What's their base level of understanding on the topic? One of the things you find out in research is when you start going very deep into research, glaucoma, age-related macular degeneration, cross-linking, you have a lot of esoteric knowledge that is not common, but you don't know it's not common because you've been doing it your whole life. For your PhD, for your master's, you've been doing it every day, and you're reading all the papers, and you're seeing all the new things that are coming out, and you're seeing all the new terms. And you forget that there are other people that did the same course, same optometry, ophthalmology like you, who are doing something else in age-related macular degeneration, something else in diabetic retinopathy. They are not conversant with the newest things that have happened in glaucoma. They're not conversant with the terms. They just remember the basic thing, high pressure, you have glaucoma. So a lot of the time when you're talking as somebody who has skill in a particular area of research, be aware that you're talking way above the level of maybe 90% of your audience. So you have to bring it down. So who is your audience? What's their level of understanding of the topic? What are you presenting to them? You often assume that your audience has a very high level of understanding of what you're presenting, which is not really true. So I give an example here. For the same paper, I have written an abstract presentation in 4 different ways, depending on whether I was presenting to undergraduate medical students, undergraduate optometry students, medical doctors, and optometry ophthalmology professors in increasing level of complexity. One of the things that has shocked me is I have presented some things to 2nd and 3rd year optometry students where they displayed a much higher understanding than practicing medical doctors, many of them who had specialized in other areas. So know your audience, know what their knowledge is, and then decide how you're going to pitch your abstract to them. Simple words or more complicated words. Simply similar to the way you might write a curriculum vitae and you're looking for 2 different jobs. One is a research job and one is a marketing job. The way you write your CV, even the presentation of the marketing job CV is completely different. You'll be talking there more about things like language skills and hobbies and stuff like that. Whereas research, you're talking about how many papers you publish and what's your H index. Okay. So in writing an abstract, we summarize it. We can summarize it to something we call 4 C's. Complete, concise, clear, cohesive. Complete means essentially, put it in your mind, I'm writing, in my paper has an introduction, it has a subject and method, it has results, it has discussion. After the introduction, I must highlight the gap in the knowledge, then I must write my purpose, then I go on to my subjects and methods. So essentially, a complete abstract has got to take a little bit of all those things from the paper so that the person essentially is reading your paper in miniature. Concise with allowance for readability. You want to be short. Don't say in 500 words what you can say in 50. But if 500 words is too much, and
your attention, please. The fire alarm evacuation system will now be tested.
Just a minute. Let me wait for them to test the fire alarm system. It will take about 2 minutes.
All right, Prof.
Please follow all future evacuation announcements. Your attention, please. The fire alarm evacuations.
Okay, so we're back. Sorry about that. It happens once a month on Wednesdays to make sure everything is okay. In terms of being concise, be concise, but with allowance for readability. So like I said, don't say in 500 words what you can say in 50. But if 50 is being exactly concise, because of readability, you might want to go to about 75 or 80 to make some sentences a little bit clear, especially when you're talking about a concept that you know is not common knowledge, either in the field or generally. Another thing that people make sometimes is that we write overly long sentences. But it was when, so therefore, comma, and then you start writing and writing and writing and writing, and you tell me what happened when Jesus Christ was on the cross. Make your sentences short. I woke up in the morning today, full stop. I found out this. The shorter your sentences, the easier they are to understand. You can take a very long sentence and then cut it into 4 or 5 shorter sentences. It makes understanding quicker, easier, and it makes reading quicker. So write short, clear sentences. You must be well organized in the writing. I always say, my friend Nabila would start, one of the reasons why her stories would go up and down and up and down. She would start at the end and continue with the beginning and end at the middle. Sometimes she will end at the beginning. The idea is to have a coherent, you're putting your research out in the world for people to see. You want to put your research in the best light. So, but essentially you're telling a story as well. Because you're talking about your research, you want to give the facts. You want to say what happened. You want to say what's the background. You want to say what's the gap in the knowledge. You want to say how your purpose is fitting that gap in the knowledge. But you have to tell an engaging story. You have to tell a story that people want to listen to. There is a way you would convey those facts accurately, but your story is not interesting. As soon as you open your mouth and start talking, half of the class, half of the lecture room or lecture hall is sleeping. So eventually you have this exciting information to share, but you don't share it properly. So you lose the audience. So make it engaging. Remember, you're telling a story, so make it coherent, make it clear. So that's the cohesive and coherence about that's what clear and cohesive mean. Okay, so I've put this here just for academic purposes. The abstracts that I've talked about so far are what we refer to as informative abstracts. That's what you'll get in medicine, science, engineering. It's much more precise. It's much more about giving information that you found in a study. In other areas in the humanities, they have a different kind of abstracts that are called descriptive abstracts. Descriptive abstracts are interesting. They'll give you an introduction and a background, but they will never give you a methods. They will never give you results. They'll never give you a conclusion. They'll just go talk about what's the focus of this paper, and then you'll have an extensive discussion. Sort of like talking about, principles and, what does this mean and so on and so forth. So descriptive abstracts are used in the humanities and the social sciences. They tend to be shorter. So whereas our own abstracts tend to be 200 to about 300 words, theirs tend to be 150 words or less. And their main sections are introduction, purpose, and focus of paper. Methods, results, and conclusions are never included in descriptive abstract. So that's the difference between descriptive abstracts and informative abstracts. Okay, so The last part here is I wanted us to look at an example of an excellent abstract, which I've just basically gone to the Arvo site and copied. So this is what they say an excellent abstract should look like. So if we read that together, it's targeting aging, geroprotective drug metformin reduces risk of adult onset open angle glaucoma. Okay, so the section is on glaucoma, obviously. Purpose. Here, they haven't written a background because the word limit, let's say 200 watts or 250 watts, if they had written a background, it would have been too much. And they're presenting to an expert audience. So they'll just go straight to the purpose. This is actually quite a normal thing. Caloric restriction and caloric restriction mimetic drugs have geroprotective effects that delay or reduce some of the risks of aging. This study tested the hypothesis that the caloric restriction mimetic drug metformin can reduce the risk of developing late onset straight open glaucoma. So metformin is used for diabetes. We analyzed 9 years of longitudinal data from a large US health claims database from 2001 to 2009. Note how they've put the date range that they've searched. That's very important because that's easy now to go back and check it up if you're doing a study, or if you're doing a follow-up study, you know where to start from and where to end. Diabetics aged above 40 with no pre-existing open-angle glaucoma were monitored for incident open-angle glaucoma. The key predictor was exposure to metformin. A Cox proportional hazard model tested the effect of metformin on the hazard of developing open-angle glaucoma, adjusting for social demographic factors, glycemic control, which is your HbA1c, and other diabetic medications, and other ocular and systemic conditions. University of Michigan Institutional Review Board deemed this anonymized database study to be exempt. So here in the methods, they've done something very interesting. In a few lines, they've told us the important things that they did. They told us that they used a longitudinal database from a longitudinal data from a large US claims database. I don't know if you guys have heard of something called big data. Big data is sort of like the way now the world is going. Everybody's storing their information in digital format instead of farms in hospitals. So nowadays, depending on if you work on somewhere where your database is digitized, you can go in and say, I want to see all the procedures that have been, say, done on diabetic eyes for the last 20 years. And you can just put in the code of diabetic retinopathy and boom, all the data comes to your computer. And when you have the ability, when you have the availability of big data to analyze, you can make much more powerful conclusions than doing small studies. So this indicates to us that this is a big data study. And it's told us who the patients are. They are diabetics who are aged above 40 and don't have any glaucoma, but they're taking metformin. And then there's another group that's not taking metformin. And the difference is they want to find out what's happening. These methods here is very, very condensed, but yet very, very clear. Results. Of the 150,016 diabetics, 5,893, which is about 4%, developed incident open-angle glaucoma. The use of a total of over 1,110 cumulative grams of metformin over a 2-year period was associated with a 25% reduction in relative risk. So relative risk is one of those things like odds ratios and hazard ratio of developing open-angle glaucoma. And then it says the hazard ratio is 0.75, 95% confidence limit, 0.59 to 0.95. These are all statistical terms. P equals 0.017, so that's significant. Compared with no metformin use, every 1 gram increase in metformin was associated with a 0.01% reduced hazard of developing open-angle glaucoma. Again, P is less than 0.05, so it's statistically significant. Therefore, somebody receiving a normal dose of metformin, which is 2 grams a day, over 2 years would show a 13% reduction in the absolute risk of developing open-angle glaucoma relative to someone who was not taking metformin. When we stratified by baseline open-angle glaucoma risk and HbA1c level, the greatest absolute metformin-induced risk reduction was seen for those with the highest baseline risk and the highest HbA1c levels. Although HbA1c levels were associated with increased risk of OAG, give you the hazard ratios and the stats and the confidence intervals and the p-value, other hypoglycemic drugs did not reduce the risk of OAG, and OAG, open-angle glaucoma, risk reduction in response to metformin occurred when HbA1c levels were taken into account. Very, very long and mealy-mouthed. And this is one of the things that we talk about when we say being concise makes readability more difficult. It looks like a lot of technical jargon, but it's actually very easy. Metformin, which is used for diabetics, helps you to control your blood sugar, helps you to control your diabetes. But essentially what they are saying here is that metformin in the group of people that have the highest risk of diabetes, so people, especially people that have a high sugar level, in those people particularly, the use of metformin prevents them, reduces the risk of them getting open-angle glaucoma, because as you know, your risk of getting glaucoma is higher, or your risk of getting open-angle glaucoma is higher when you have diabetic retinopathy, partly because of neovascularization around the area of the anterior chamber angle. That's what usually causes your risk of open-angle glaucoma to increase. Metformin reduces that risk. It doesn't prevent it, but it reduces it. And it doesn't reduce it equally in everybody. It reduces it in those people with the highest risk of progression of diabetic retinopathy. Now, therefore, you would think that it's because metformin is an effective drug in reducing the HbA1c, which is your blood sugar level, your glycosylated hemoglobin. But what they are saying here is that other drugs that reduce the HbA1c levels similarly to metformin didn't have that effect. So they're now telling you, therefore, metformin must be doing it another way. Maybe using juju or something. We don't know, but it's doing it somehow. So what they're suspecting here is, what is this other pathway that metformin is affecting? And if they can prove that metformin affects this pathway, then they can maybe start giving metformin to people who are not diabetic, but who might be at risk of open-angle glaucoma. So, conclusions. Metformin was associated with a reduced risk of open-angle glaucoma. This open-angle glaucoma risk reduction was dose-dependent. So the higher the dose, the smaller the risk. And it was independent of glycemic control. So metformin was not reducing glaucoma using its skills of reducing blood sugar. It was doing it by another way. Other diabetes medications did not confer similar risk reduction. So they reduce, those other diabetes medications reduce your blood sugar, but still did not reduce your risk for open-angle glaucoma. That's proof that it's by different mechanisms. Thus, systems beyond glycemic control, blood sugar control, such as neurogenesis, longevity pathways, and or reduced inflammation may be involved in how metformin is causing a reduced risk of open-angle glaucoma. If confirmed by prospective clinical trials, these findings will offer new treatments for this sight-threatening disease and perhaps for other diseases of aging as well. This is a brilliant abstract. It's a bit wordy, it's a bit too concise, but they had to work within the word limit. But in here, they've told you everything that their paper found. So from my point of view, this abstract, basically, I will see this, and the first thing I'll just do is I want to go and download the paper to see in detail what happened. So you should be able to excite the audience that you're presenting to, tell them what you did during your study, and give them enough information to decide if they want to read the paper. So when you write an abstract, this is the kind of thing that you want to do when you're writing an informative abstract. Maybe hopefully you have a slightly bigger word limit, like 300 words, where you can make some of the things that they described in their results a little bit more expanded so that they're easy to read and understand. Okay. Okay. So with that, the talk is ended. Thank you very much. I'm open for any questions.
Thank you, Prof.
Thank you.
Thank you, Prof, for the presentation. I guess the floor is now open for any questions. We can type in the chat box. Or you can raise your hand if you want to ask.
Yeah, there's somebody's hands that are up. You're going always there.
Hi, thank you, Prof, for the wonderful presentation. Just two quick questions. How do you strike a balance between being concise and achieving readability? And two, are there instances you do not have to structure your abstracts in scientific papers?
Structuring between being concise and readability, it's, to be honest, is very difficult. It's almost like starting to learn ophthalmoscopy for the first time. It takes you a while to get the skill. It also depends on the audience that you have. It's hard. So the easiest way I would say would be write the abstract how you would like to write it in your own words. That's how I will normally do it. Then I will now then structure it, remove it to meet the word limit. Once I meet the word limit, usually that's as concise as I'm going to have it. Then it might help if you have somebody that is doing a fellow student, but doing a PhD in a different part of ophthalmology or optometry or medicine, or maybe even in a different field whatsoever completely, and give them the abstract to read and tell them, ask them if they understand it. That's one of the easiest ways to check for readability, because all those acronyms and stuff that you understand, they don't understand them. So if they read it, especially if somebody from a completely different field reads the abstract and is able to get what you're saying, then your readability is good. That's one of the ways I would do it. And what was your second question again? You said about structured abstracts. Yes, there are meetings where you can write an abstract that is not structured, but don't be sort of like deceived by the not being structured. It's like me telling you, you must make these 5 points when you're talking to me in a discussion, and then you write number 1, da, 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 number 2, da, 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 da. Then I say, okay, don't structure it. And then instead of putting number 1, number 2, what you now then do is you write it in paragraphs. So the first number 1 point comes in a paragraph, the second number 2 point comes in a paragraph, but you don't explicitly number them 1, 2, 3, 4, 5. Because in our field, even when your abstract is not structured, you still have to give the main gist of what you did. You still have to give the background, you have to give the purpose, you have to give all those things. But you can write it, yes, in a not structured way, which basically you don't put your methods, you don't put your results, but you still have to write all those things, essentially separating them by paragraphs. Does that answer your question?
Yeah, so back to the first question. In trying to achieve that readability, right, don't you think you might compromise quality of the abstract?
No. You know how some people think that because you're speaking big English, therefore you understand what you're talking about? The really clever people, if you read Stephen Hawking's A Brief History of Time, it's one of the best books I've read, you will find out how this very brilliant physicist took massive, big concepts and explained them in simple language. The simpler the language actually shows how intelligent you are. So but there are people who think that because you're using big English, therefore you are better. So therefore the abstract quality is better. No, the abstract quality is very good when you've stated your purpose, you've stated what you did in your methods, you've stated your results, and you've stated your conclusions. Don't worry about the style of the language. Style of the language is, some people are more stylistic than others. I don't think once you have the main things in the abstract and you've met the word limit, the abstract is fine. So I think the readability doesn't compromise it. Some people might think that, but in actual fact, if I get the same information from your abstract with better readability and than from another abstract that tries to use big words, I will actually mark your abstract better. Readability is, at this point now, readability is something that a lot of people don't quite pay attention to, but it's a very, very big deal. And it's getting more and more of a big deal nowadays, especially as scientists now are being tasked more and more with communicating with people who don't have those skills and therefore don't understand the big words that we use when we communicate.
Okay, the reason I'm asking is because the more technical your subject is, and the more you tend to use those keywords, those technical words, will make it a bit more difficult for a layman to understand. So are you thinking of reducing the way you use those keywords? Because I'm thinking that might reduce the information or the quality of information you're trying to pass across.
Yes. Okay. So in this particular case now, you've brought up a particular, this is a very, very, very narrow case where you are in such an esoteric field where there are lots of complicated jargon that you need to use, like in, say, genetics, for example. And you're talking about the short chain leucine repeated, you're talking about this. And yes, in that case, you're going to be presenting an abstract to a group of people who are very, expert people, essentially. So yes, then you have to include the jargon because you don't have any choice. You have 200 words. You're going for a conference of the top geneticists. You don't have to concentrate on readability then. This is where you now have to merge writing the abstract with knowing your audience. So in this case, you are writing for people who are very technical, use all the jargon. But if you were now then presenting that same talk to undergraduate medical students or people from different medical specialties that don't know anything about genetics, then first of all, you definitely have a bigger abstract word limit. And then you have to basically dumb it down. You're essentially meaning that you have to, all those jargon, you have to explain what they mean.
That makes sense. Thank you, Prof.
You're welcome.
Yeah, so Prof,
Thank you.
yeah, we've got questions here, Molo. There are questions on the chat, so Prof can address them.
Yeah, from Modern IK Foundations, thank you, Prof. Kindly give us an example of a bad abstract
Yes.
or an abstract that did not meet the criteria you described in your presentation.
Okay. I have a lot of bad abstracts here, but I don't want to embarrass anybody. So what I want to do, I would have to do this and send it later on. I will write in my hand what is an example of a bad abstract. But let me tell you what a bad abstract won't do. It won't summarize the paper. A bad abstract, one of the things that will happen is you get conclusions, and the person is making conclusions that do not come from the study. As a rule, when you're writing an abstract, the conclusion must be what you found from the study, not what you think, not what you would have liked to happen, but exactly what you found from the study. Anything after, if you write anything in your conclusion that wasn't directly inferred from your study, it's a bad abstract. Another thing about bad abstracts, and this is where sometimes I say it's bad, sometimes I say it's deliberately bad because people are lying, cheating, don't want to actually say what their methods are. They don't describe the methods that they use in a way that you understand what they did, how and why. So they sort of like forged, and they say, oh, we did da, 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 da. And then you read the methods and you come out thinking, we didn't get this. Another thing about bad abstracts is about the way they analyze their results. So if there are times when you should use a paired t-test, there are times when you should use ANOVA, there are times when you should use much more complicated models, depending on the data that you have. And they use inappropriate tests for what they're supposed to have done. It means that, they didn't think about the statistics before, or they did not have the consultation of a statistician. That's another example of a bad abstract. So again, think about, if you're thinking of a bad abstract, don't think about the whole abstract. Think about the abstract in points. Introduction, purpose. Some abstracts won't even state their purpose. Some abstracts will write a background, but at the end of the background, they won't tell you what's the gap in the knowledge. They'll just go from that and tell you their purpose. That's not nice. It's different if you write only your purpose, but if you're writing a background before your purpose, then at the end of the background, you have to state what the gap in the knowledge is so that we know what you're trying to feel. So again, so just look at the different stages, and then they just don't do them well. They don't do the introduction well. They don't do the background well. They don't do the purpose well. They don't do the subjects and methods well. They don't do the results well. They don't do the conclusion well. Now, if everything is perfect and it's just the conclusion that's not written well, then that's not as bad as if the methods are bad, the results are bad, the conclusion is bad. And then you can have abstracts that are so terrible that you can pick holes in everything from the background to the purpose to the conclusion. So it gets worse. It's on a sliding scale. But if you want, I can write a couple of bad abstracts and send.
Thank you, Prof. That would be very much appreciated.
Okay.
The next question from Dr. Benedict. Thank you, Prof. The abstract is filled with too many abbreviations. Is that allowed?
It depends on the field. Generally, most people are clamping down on abbreviations. That's number one. But it depends on the field. There are some fields where you cannot help but use many abbreviations. But what they now then say is for every abbreviation you use, the first time you state that abbreviation, you should state the full term and then put the abbreviation in brackets. Then after that, you can now then use the abbreviation. But there are some specialties, there are some parts of engineering, some parts of physics where the abbreviations are just, it seems that they are completely unavoidable. But nowadays, people are clamping down on that. So if you are submitting in optometry abstracts or medical abstracts now, they will tell you minimize abbreviations, and the first time you use an abbreviation, you must state it fully so that the person can follow what you're saying.
Thank you, Prof. The next question
Common
is
mistakes. Common mistakes, right?
Yeah. Yes.
Okay.
Thank you.
So common mistakes that the students make in writing abstracts. Which student? Young student, older student, mature student, a student that has finished masters and is now doing PhD, a student that is coming from undergraduate to masters, a student, some undergraduate students, depending on the university that they went to, they have enough experience with research that they have an idea. So the mistakes that students make depends on their level of exposure to research in the first place. So they're not uniform. Not being able to structure the abstract properly is one of the mistakes that they make. Some students basically haven't had any guidance at all writing an abstract. They don't know what writing an abstract is. They're just going to write in 250 words what comes to their mind about their study. And they will write the most important things, forgetting that they have to touch on different sections. They have to touch about the background, the purpose, the methods. You have to some people spend a lot of time on the background and the purpose. They will not write anything about the methods, and they will just jump to the results. So those are some of the mistakes that they make. But these mistakes that the students make depend on the particular student and their exposure to research. Again, it's the same thing. Look at the abstract as a mini version of the paper. So background, purpose, subject and methods, results, conclusion. How well do you write all those parts? Does your abstract actually reflect all those parts? Some people miss some parts out or describe them inadequately. So those would be the kind of mistakes that people make. Do I have any example for an abstract for a case report? Yeah, I can get lots of examples. We have lots of examples of abstracts for case reports. Yes. So thank you. It says the presentation is very helpful, especially why I said writing the abstract to meet your type of audience. That's the key thing. That's something that you should never underestimate. You have to always, when you're communicating with somebody, you have to put yourself in the mind of the person to understand what they believe before you now then start talking to them to say, this is how to do it. It's not just with abstracts, even with telling people stories. or here we have a course that we do where we talk about delivering bad news to patients. And one of the things that we teach the students as you have to ask the patient, what do you want to know? Do you want me to give you everything, or do you want me to just tell you what you need to know to manage your condition? Some people don't want to know everything, and if giving them too much of information causes information overload, and then they just shut down. So yes. What is the generally accepted tense of voice? Should we be past or present, especially where in cases where it was not specified? Okay, I would say past tense, because you have done the study. You've done the study, so you're reporting what you found. So use past tense because you're not doing it at the time. And then the thing about it is to be consistent in using past tense. Once you say, I'm going to use past tense, just use past tense. Because remember, you're reporting something that has already been done. So you normally report it in past tense. Okay. Okay, I've got an email here. When do you classify an abstract as incoherent or unreadable? That one is easy. There are so many abstracts that I've read. I read the abstract and I brought coffee. I drank coffee. I read it again. I didn't understand it. I went and took a glass of whiskey. Then after that, I understood it a little bit. They are so just incoherent. It's just completely, it's hard to explain, but you know, when I'm trying to think of which politicians I can think of that they say stuff and you don't know what they're talking about. But sometimes you listen to some people and they describe a simple concept and it's clear. And then you get somebody else to describe the same concept and they're going around in circles.
The past governor of states.
What?
Professor Ayade.
Yes. It's like that?
I said, yes, it is like that. He will say a lot of that doesn't make sense in big English, and in the end, he ended up nothing.
That's right. So just some people that what I find out is that different people have different skills, and there's some people that are just excellent communicators. They will take a very complex thing and they'll just tell you one sentence and you get it. And Microsoft Help, everybody here knows Microsoft Help. Have you ever tried to do something on Excel or Word and you go to Microsoft and you say how to do this? Microsoft Help is unbelievable. It is the worst thing ever. And then you read Microsoft Help and you're much more confused than when you started. And then you go online and then you ask the same question on Google, and one 17-year-old will answer the same question in 2 lines. And you just go and do it on Excel. So that's the difference between being coherent and incoherent. Okay. Yes. Structured or unstructured abstract, which is standardized. Well, structured or unstructured abstract, it depends on the conference that you're going for. Some people will tell you that this abstract should be unstructured, but then the unstructured, like I said, it's just a small trick. It just means don't put methods, don't put introduction, don't write a heading of results, but you still discuss it. You still discuss your purpose, you still discuss your introduction, because the abstract doesn't mean anything without those things. So the structured or unstructured is just, it's like speaking American English and British English. It's, same difference. But your journal that you're submitting to will tell you. Any differences in abstracts for case reports or any other scientific abstracts? Yes. So it depends on the journal. One of the things I would suggest is if you just pick at random 4 or 5 optometry/ophthalmology journals, each journal on their website has a section on instructions to authors. Go and read the instructions to authors for 5 different journals. It is illuminating, because they will tell you how to structure, how to write it, how to structure your paper, how to structure your abstract, how to write your references, whether you're going to use Harvard or Vancouver. It tells you the different styles, but it also tells you the different things that they want. So they will tell you if you're writing a study, if you're writing a randomized controlled trial, this is how you're going to report it. If you're writing a case report, this is how you're going to report it, and so on and so forth. If you're writing a systematic, these are the things you. So they will tell you which guidelines to follow. And looking at, by the time you see 5 or 6 optometry/ophthalmology journals, and you see what they expect you to do, then you will see that there are differences between writing case reports and writing randomized control trials and writing systematic reviews. And this vary slightly from journal to journal, especially when you're going into other things like how to report your references. Like, do you use the Vancouver style or the Harvard style? Or there's a journal called Graves Archives for Clinical Experimental Ophthalmology, which is, I think it's a German paper. Very interesting. They have one of the weirdest ways of writing their references, but it varies from journal to journal. But if you read it, you will see what the journals want. Okay. Any differences in abstracts for case reports outside your abstracts? Structured, unstructured. Okay. Structured and unstructured abstracts, which is standardized. But it's really standardized. It's what the journal asks for. It's what the journal asks for. So the journal or the conference that you're going to go for, we tell you, we want your abstract to be structured. We want it to be unstructured. And they will give you detailed instructions of how to do the structure and how to do, and then they will usually give you an example. But again, it's one of these things where I try not to get too caught up in legalistic and technical things. Whether your abstract is structured or not, you are still going to write the same information in it. The most important thing about structure is that you don't put in structured, you put the headings, background, purpose, methods, subjects and methods, result. In unstructured, you write it without those headings, but you write. So imagine like to change an abstract from structure to structured, I will do 2 things. I will delete all the headings. Then I will make each one a new paragraph with indented. That's unstructured. So, but you still have to tell the same story, because the purpose of the abstract is to give a miniaturized version of your paper. The person must understand why you did what you did, exactly how you did it, what you found, and what it means. That's it. That's it. Okay, I think I've answered all the questions.
I also think that one other important thing is that most people make the mistake of putting reference in their abstracts.
Yes. There's no need for that.
Should talk about that.
Yes, yes. There's no need for that. Although it's like when you have 250 words or like 200 words sometimes, alarm go blow now. Nobody will tell you to shorten it. You will now start knowing when to put apostrophe and mix words together and hyphenate words. Because when you have such a small word limit, you don't really have the time to do anything. But sometimes some journals and some conferences would allow you that extra thing to have reference. So they might say 300 words excluding references, or 350 words excluding references. But if you just say 250 words, yeah, you can't put references. You're right.
Yeah, and Prof, just to add to that, thanks for that presentation. I think it's also very important. I see that all the time when you have your abstract, you've told us what your results are, but your conclusion is not drawn from that. So I'll give you an instance. In your entire paper, you have 1 page to play around with discussion. You can talk about so many things. Maybe that discussion, that conclusion is in your discussion point of the main article. But in the abstract that you've presented, there's a result that does not link to that conclusion at all. It doesn't matter whether you have it in the document. When people read the full paper, you cannot present a discussion or a conclusion that is not derived from the result of your abstract. So whatever you want to talk about in the conclusion, make sure in that abstract result, you've talked about it. You've highlighted it. So I'll give you an instance. Somebody is talking about intraocular pressure measured by 2 devices. And when they go to their discussion, they start telling us that some other devices do not measure intraocular pressure the same way. However, they are not comparing that device at all in the results. So it may have been in your conclusion, in your discussion, in your main paper. It has no place in that abstract. If it's important, then bring that result up in the abstract. So it's derived from that. So it's important we know that abstract stands alone. You know, before people read your main article, they've seen your abstract, they decide whether they go digging or not. So
Yes.
if that abstract does not reflect what you've presented in the conclusion, they will just score it low. It will be taken off.
Yeah.
So, and the other thing is to note that recently systematic reviews and meta-analysis are becoming one of the strongest levels of evidence people use now. If your article has got those keywords, let them show in your abstract. You know, let those keywords that will make people search for your article show in your abstract. If it's intraocular pressure you're centering on, if it's cross-linking, make sure those particular parameters are shown there. Because when people screen those articles, they are screening the abstract first before they go to main text. So the full text comes later. If they screen it out, then nobody recognizes that paper. So always look at that in mind when you're, what do you want people to remember this paper for? That abstract should show that. I guess those are the things I kind of want to add. Yep.
Yes, that's actually very correct. And yes, and the way I would think about it is I would think about it backwards a bit, because let's say you're writing the abstract even before the paper, or the people haven't seen the paper. So you're writing the abstract to people to introduce them to what's in the paper. This is where the precision comes in. And one of the things about being concise, where you have a few words, is that you should only say what matters. And one of the ways of saying what matters is in your conclusion. As Uche said, it's very, very important. Your conclusion shouldn't even have a comma that comes from outside your work. Everything in your conclusion must be directly from your work. If you have something in your conclusion that maybe is partly not from your work, remove it. It should be, the conclusion should be exactly what you found from your work, not what you thought you should have found, not what you found, not what your results imply. What your results might imply, you talk about it in the discussion of the paper. But in the conclusion of the abstract, even in the conclusion of the paper, it must be dead centered on what your results found. The thing about writing an abstract, if you ask me, is one of those things that enforces discipline. It's, there's discipline of many things. There's discipline of being on time to wherever you're going. I need to be at work by 9 o'clock. I need to be at the exam by 9 o'clock. So I aim to get there for 8:30, so that with all the traffic and everything and whatever, I will be there by 8:45. It's a similar kind of discipline that you have when you're writing your abstracts. You cut down your words to what's absolutely necessary. Why did you do what you did? How did you do it? What did you find exactly? And what does it mean? Full stop. That discipline is actually harder to get than most people think. It takes a while to do it and then get used to it. So yes, as Uche said, anything in your conclusion must be what you found, not what somebody found before you, not what you thought you were going to find, not what the implications are. What did you find from this study? Because that conclusion is essentially justifying why you even did the study in the first place. Very important.
Thank you, Prof.
Thank you very much.
I think there is no more questions. Everything has been answered. Dr. Levi, you can take over the mic.
Yeah, thanks
Dr.
again.
Levi, yeah.
Yep, I'm here. Thank you so much. And on behalf of the African chapter of the American Academy of Optometry, we owe Prof a lot. I know how busy he is. To be able to drag him off his schedule and get him on board here to spend useful hours with us is really something very, very difficult to do. But we do appreciate that, and I thank you for the insightful lecture. And I think many of us who are in the process of submitting abstract to the Academy will really benefit from this, because this is the time of conference calls for abstracts, so people are really getting ready. The reason we thought this was a good time to kind of shed light on how this can be done and done well. So to increase our chances of getting our abstracts through the committees that screen them. So thanks for spending time with us. And just on that same note, I also thank everybody who has joined. It's quite late in some places. Some African countries are a bit 3 hours ahead of the other 2 hours. So you could imagine some people it's just midnight for them, some very early in the next day. So for those who sat down to listen to this, we do appreciate your time as well. Now we've sent some questionnaires for people to complete. We've gotten few responses, but I do encourage everybody who hasn't had time to do it. It doesn't take more than 5 minutes to complete that questionnaire, because we need that for planning. We're planning for group accommodations for the academy. We're planning for events for our African dinner party. We need to know who the members of the African chapter are, so we do our reporting properly. So we do encourage you to please spend some 5 minutes to fill out that questionnaire. It's on the platforms that we monitor. We'll post it again on those platforms after this meeting. So I encourage you to please spend time to do that, because it does help us to keep records and to make sure that we are covering everyone the way we should. So we appreciate your time as well in doing that. I think for the rest of the team, we would say thanks everybody again for joining, and I'll leave that again to Mologadi. I appreciate your time too. For everybody who call on to help to moderate this, we do understand the work that goes into it, the preparation, the writing, the getting ready. We do appreciate that time. So thanks for making time to facilitate this session for us. And we'll look forward to the next section as well. Thank you very much.
Thank you very much, Dr. Levi and Prof. Thank you very much. We've really learned a lot from the presentation, and also learned how to pronounce your surname.
No problem. I won't report it to my wife anymore.
Thank you. Our closing prayer will be by Dr. Bridget. She was struggling to connect earlier. I don't know if now she's able to connect. Dr. Bridget, you can unmute. It looks like she's not here. Let me do the closing prayer. God the Father, God the Son, God the Holy Spirit. Heavenly Father, we once again come before you this evening. We thank you for giving us this opportunity to be able to learn and gain more knowledge from our fellow colleagues. Give us more opportunities like this in the future, so that we can be better clinicians and be able to help our communities. We like to uphold our leaders and everybody who is in the group, trying to learn, trying to better themselves, so that we can continue to be better clinicians. We thank everything in Jesus' name. Amen.
Amen. Thank you.
Amen.
Thank
Thanks, everyone.
you.
And thanks, Prof.